Well, now, recently did a television show with Dr. Louis Feta, and we talked about spider veins, and I'm telling you, the reaction to it was absolutely enormous. So many calls, so many inquiries, and I'm sure they came into your office as well.
I'm telling you have me working through the end of next year.
That's right. So we are going to talk today about spider veins with Dr. Feta and one of his patients, Dorothy Annunziata. It's nice to have you here, Dorothy, and thank you for joining us. I would think that some women might be a little squeamish about showing theirs and what have you, but
well, Dorothy's
not
very
Dorothy,
kind
huh?
to show us the problem she had, because I say spider veins are a variant of varicose veins, and I would say at least 75% of women have them at one time or another. And they're the little things you see on the legs that are reddish or bluish down the leg. It's seen in men, too, but much less rarely. Women have, in general, thinner skin, and I do almost entirely cosmetic work. In the past, women would go to doctors such as vascular surgeons who really don't do that kind of work, and they'd say, oh, just forget about it. Meanwhile, their wives are going to people like me or someone in an allied field which just does cosmetic work, and there is a treatment for them now, and the veins on the legs are the main problem, but it's also a problem sometimes in the face.
Well, let me ask you a couple of quick questions. First of all, what is the difference between a spider vein and a varicose vein?
It's, in my belief, it's in the same type of family. A varicose vein is a large vein of the leg where the wall is more or less blown out. The elastic layer becomes broken down, and they're often seen in pregnant women. They're inherited, people who stand on their feet a lot, and those are the big, large
purple veins.
And they can be a problem. They should be seen by a doctor because there's a higher incidence of embolism, which you heard about with little things that can happen there, and many times they're very painful. The things we're talking about is mainly cosmetic, and they're usually not painful, they're just unsightly. Women don't want to go on the beach, and they don't want to play tennis or things of that sort.
Yeah, and we have some pictures of them as well. Why don't we take a look at them right now so you see exactly
they're on the table.
Oh, they're on the table. What we're talking about. Yeah, these are some before and after pictures, and this is typical of spider veins.
So here's a pre-treatment patient, and then after several treatments, you'll see it's almost clear. Occasionally they can recur, and we just inject them again.
Mm-hmm. You inject some kind of serum right into the vein?
It's not a serum. What we use is a medicine called ethoxysclerol. I've been using this about 14 years and well over 2,000 patients, and I've experienced no complications which have been reported with other medicines like hypertonic saline, which you can get hyperpigmentation, you can, do brown spots, you can get some areas of infection. I, fortunately, have had no problems in the medicine that I've been using. And the way the medicine works is interesting. You inject a little bit of the medicine right into these little tiny venules. It's very small, mind you, so I use a very fine needle, we call a 30 gauge, which is almost the size of a hair. I'm going to show it to you on the air in a moment. When we inject it, we put pressure right on the area where we've injected it, and this material causes these little vessels to stick together. And after a while, blood doesn't go through them because you see the blood is brought back to your heart by the deep vessels, not these small little fellows.
I see.
And that's why it works.
How does this last for a certain amount of time, or
It usually
is it forever?
lasts forever.
Really?
Occasionally they can open up, maybe in about 5 or 10%. You have to go back and re-inject it. And as we inject it, mind you, it doesn't go away immediately. You may have to inject the same area 3 or 4 times because, don't forget, this is blood that's flowing. So you have to get this medicine in it to cause the thing to stick together while it's still flowing. So you may have to do it a few times, and one day you wake up and it's gone.
Dorothy, when did you first notice yours?
I would say right at the time I was carrying my son, which was about almost 23 years ago.
23 years ago.
During your pregnancy.
Yeah,
That's when I got mine.
Oh, you have some
I have
too?
a few, yes, and I remember. Well, I mean, they're not
Interesting.
advanced case, but I mean, I have some, yes.
Really?
And I'm just a kind of a coward about going and having.
It's not painful, really. It's not.
And when
what
did you
you all
decide to
say.
do something about it?
Well, while I was in work one day, my husband was watching your show, and he called
Oh,
me.
he saw the show that
He
Dr.
saw the
Feta was
show
on.
that
I
Dr.
see,
Feta
yeah.
was on.
So
and I've always complained about them, and I said, well, if you ever watch TV, if you ever hear anything about it, read anything about it, let me know. And I don't think it was a few months later, he called me up in work, and he said to me, Spider Lady. That's on my boy.
Oh, what an affectionate term.
And he hung up.
Maybe I should use that
Sounds
at
like your
home.
sense of humor.
Spider Lady 2.
So I called him back, and I said, what are you talking about? And he says, well, I found a doctor on TV. He was on the Regis show. And he said that, he can do something for the veins that have been bothering you all these years. I said, well, find out more about it. Hurry up, So he called, and he called me back a little later, and he says, you're going next Wednesday.
Well, good.
And I said, that's fantastic. I was like...
How noticeable was it?
Very noticeable.
Did it bother you?
Very much, yes.
Mm-hmm.
It just makes you feel very uncomfortable when you go on the beach or you wear shorts or whatever, You almost wish you didn't,
Yeah, sure.
I did a lot of backyard sunbathing.
You've had one treatment already, Dorothy?
Yes.
Now,
one
tell me
last
the
Wednesday.
truth. Did it hurt?
No.
Not at all?
It's a little uncomfortable, but it doesn't hurt.
Dorothy, it's a needle.
I love that word,
I hate
discomfort.
needles.
Just a little discomfort.
I don't like going for blood tests. I shiver at the thought of a dentist. But when
Absolutely.
you have something you want to get rid of bad enough,
That's the
you
trick.
didn't even think about it.
All right. Well,
really
why
don't.
don't you show us some of the things, what it is that we're going to inject in her first, and then we'll show you how it's actually applied, and then we'll watch the spider vein disappear before your eyes.
Now, what I use here is a glass syringe, as you can see here. Maybe the cameras can get a close-up, with a very fine 30-gauge needle. And I use an ampule or so of the ethoxysclerol. It comes prepackaged like this.
Uh-huh.
And we just pull the skin taut, and I inject the little venial and put pressure.
And is there a mark that's left until it heals? Do you
It
have
can get a little
redness?
black and blue redness, yes.
And how long does it take before some of them disappear?
Again, that's a difficult question to answer, because you're talking about things that's constantly flowing. Some veins, venules, may respond after one treatment. Other ones may take 4 or 5. But over a period of time, it may just all of a sudden go away.
Now, do you do these in periods of, say, half an hour sessions? And what
I
is the
usually use
cost
1
involved?
ampule per visit, sometimes 2, because in all my experience, I've never had a problem, an allergic reaction or anything else, by using about 1 or 2 of these ampules. The expense, and insurance usually will reimburse somebody for this. The first visit we charge $150, and follow-ups are about $125. Now, mind you, it's not for one vein. We use up the full ampule, and a session takes anywhere from 15 to 20 minutes, and sometimes longer or shorter, depending upon how easy it is to treat these venules.
All right, well, let's see you, let's see what
Right
you
now,
do.
Regis?
Yeah,
You ready?
Yeah, I don't know if I'm ready or not, but let's...
Do you want me, are you all ready? Okay, we'll put a little in. Now, let me see what I can do here. I have to open the ampule up, and if you'll, Regis, if you'll
Right
help
over
me
here,
arrange
George.
my patient here.
Yes.
I'll just do a little bit. And we crack open the ampule like this, and we start to pull up some of the solution into the
That's how you
syringe.
do it, huh?
That's it, see? I find by using a glass syringe, for me, the piston action is much freer, much easier to use.
Now, have you taken all the solution in here?
No,
or
not all, just a little
about
bit.
half, huh?
And what I do is, I get some of the little foam out. Now, I keep a little bit of air in here, so as I inject the venule, it'll push the rest of the blood out of this little area, and then I go right ahead. So,
I don't know if we're
There you
going
go.
to help the spider vein movement or not with this. Dorothy, you getting nervous? You okay?
now
Now,
what I
I
do
guarantee
is,
you, we just cannot look at this, right? You cannot.
I'm going to try.
Dorothy, pull your back a bit like this. Can you get?
Now, there's
Right.
one right
Now,
there. I
now-
see it.
You see it. Now, you see, this area has already been treated because it's already darkened. It's more... the
Has
vessel's
it
really-
helped at all, the first
Yeah, you
treatment?
can- right, it's already helped. So
Quite
it
a
may not go in exactly the way we want it to show for the audience, but we'll try. Pull back a little bit here. There we are. We go in here like this.
Dorothy?
You want to hold my hand?
Dorothy.
That doesn't hurt, huh?
No, it really doesn't. It's
Now, you
one
see-
of the...
did you
Boy,
see it,
she's
Blanche?
brave.
Did you see it
Do you
Blanche
have
on
any
the air?
feeling down there?
Yes, I saw it pop right up in the air.
I'm
Then we
really
go another area
coward.
over here.
So you just
Notice?
go all around it then,
That's
huh?
right. I try to get a little vessel that communicates with the other ones, but if we don't, we just go and do each one piecemeal.
Now, this, you say, is hereditary. Does your mother have
Yeah,
spider
she
end?
does. It does seem to run in my mother's
Now, if you
side
see
of
here
the
also,
family.
Regis, a piece of cotton, please.
Yes, of course.
Dr. Philbin, please.
Cotton.
Now, you know, I'm going to say, this looks, I thought this was more like a varicose vein. I thought
It's
spider
in- it's
veins
in the
were
same-
lighter in color.
It's in the same family. I
Could
mean,
you do it with varicose veins, too?
Oh, yes. I use a different concentration of solution. This is for the smaller ones. If it was a larger one, I would use a higher concentration of the same material.
You see, I always thought these veins popped out when you stood too long.
I'll just try
or-
one more so the camera can get an
But
idea
I guess
of what
it's
we're doing.
hereditary, and that's it, right?
I often thought
Dorothy,
maybe
is this
if...
painful?
No, not at all.
Can't look. What if you wore
Notice- notice-
support hose? Would that help while you were
Yes,
pregnant?
exactly. It certainly will help. And I think jogging is bad for women on hard surfaces. So I tell them, no. If you have a history in the family of these things, no jogging. Dorothy, put your hand in. Thank
So
you.
she's to hold it like that. Now, this is what a
That's
treatment
right.
would be like
Yes,
in your office.
in the office.
Doesn't bother you at all, huh, Dorothy?
No, and I really don't like needles. I really don't. But this, it
It's
really
not a
doesn't hurt.
sensitive
It's-
area, then, for
You know, Dorothy,
I
maybe
don't
someday
think
we'll
so.
have you come back and we'll see if that's gone.
Okay.
Because pictures are pictures, but to see it again,
Okay.
why don't you come back in the envelope that we have waiting for us? With the headline. I'll give you a couple of weeks.
Just
Find
seal
out
her
then.
up.
Very, very interesting. Yeah,
I
this was
think-
the next step that I wanted to see, after talking about it, to see exactly what
We
it was.
don't use this technique on the face. And other people often get them around the nose. We
Yeah.
don't use that. We use electrosurgery, or if it recurs after electrosurgery, that's a small little fine needle,
Yeah.
we use laser. But
Right.
if you use laser, and we mentioned this before, remember that area that's been used with a laser will never tan. And that's important for people to know.
right.
People very all have a laser beam done.
Sure.
There are some problems with that, too.
Thanks again, Dr.
My
Fetter, very
pleasure.
much.
Thank
Dr.
you.
Louis
Very
Fetter,
interesting.
New York City, and we thank you, Dorothy, very much for being with us. We'll come right back with Father Bruce Ritter from the Covenant House in Times Square in just a moment.